Good afternoon. My name is Dr. A, and I am a medical doctor who specializes in enhancing your health and wellness through medical weight loss, hormone balancing, body sculpting, and addiction medicine to improve your quality of life. I'd like to thank you so much for those of you who've joined me today. So, hello and welcome, and it's good to see you. And if you're here live, please type hi in the comments below so that I can know that you're there. And if you're back watching the replay, I thank you so much for coming and visiting us as well. Please type replay in the comments so that I know you visited. And if you have questions along the way, please feel free to type those in the comments as well, and I will do my best to answer them to the best of my ability. For the last few weeks, I've been talking about hormonal changes that take place as we age and how this can affect our health and our weight. Well, there's a new hormone to discuss today, and this one actually increases as we get older. Most of us deal with stress of some form on a regular basis, whether that's physical stress, emotional stress. And today, I would like to talk about how this stress can affect our hormones and our weight. So, I've already discussed symptoms such as fatigue, irritability, decreased muscle mass, weight gain, and sexual dysfunction, which often surface as we age. And so, are there any other contributing factors to these symptoms that we suffer from? Well, I'm sure you know others who have the exact same question or experience those kind of symptoms. So please be sure to share this video. And if you want some one-on-one attention to address your specific needs, please either give us a call at 614-442-2600 or go to our website, prohealthservices.org, and click the Book Now button, and we'd be happy to schedule an appointment for you. So, the topic today is a new hormone that I haven't discussed yet called cortisol, and in particular, excess cortisol, where you have more than what you're supposed to. Well, as I said before, in stressful situations, our body naturally produces cortisol, and this is how we respond to the stress. So the cortisol goes up, and then when the stress goes away, the cortisol is supposed to go back down to normal. But sometimes that just doesn't happen because in our day and age, we stay stressed 365 days a year, 24/7. We're just going, 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 and we don't give our body the chance to have the cortisol come back to normal. Well, this can cause some problems. And then, as I said, also, as we get older, our cortisol level naturally increases. And so this can cause symptoms. So, what does cortisol do? Well, cortisol balances our blood sugar. You might know if someone takes cortisol, that actually causes the blood sugar to go up. Cortisol plays a role in weight control. It helps with our immune system. It plays a role in the rate of our bones turning over. Cortisol plays a role in stress reduction. It can play a role in sleep, where sometimes people have sleeping problems. It can play a role in protein synthesis, and protein synthesis is important for building muscle. It can play a role in our mood and our thoughts. And cortisol can influence other hormones, which I'll talk about shortly. Lastly, it's an anti-inflammatory. And so if you've ever had poison ivy or wheezing and were given prednisone or a Meddraw dose pack, those are basically glucocorticoids designed to increase the cortisol in your body because cortisol is an anti-inflammatory. So high cortisol, though, especially when it stays high, again, can wreak havoc. And one of the things it can do is it can actually suppress our testosterone production and the function of testosterone receptors. And so if the cortisol is too high, your testosterone level may not be where it's supposed to be. And I spoke about that last week, or your receptors may not respond the way that they're supposed to. So there's testosterone, but the receptors just don't work very well. As a result, you can have symptoms of low testosterone, such as fatigue, depression, osteoporosis, insomnia, decreased libido, decreased muscle mass, etc. Memory problems, heart disease, decreased cognitive functions, these can all be related to low testosterone. So again, if the cortisol is too high, it may drive your testosterone low or cause the testosterone receptors to not work well, and then you end up with these symptoms. High cortisol can also increase hypothyroidism or affect the thyroid gland negatively by suppressing the TSH, which is important in the production of thyroid hormone, or it can also block the conversion of thyroid hormone to the active form. And the active form is what you need to actually do something. Or it can also decrease the function of thyroid receptors, just like it can decrease the function of testosterone receptors. Thus, if the cortisol is too high and stays that way, you might have symptoms of low thyroid. And we've talked before about how that can play a role in fatigue, that can decrease the metabolism, and that can also lead to weight gain because of a slower metabolism. High cortisol can also increase insulin resistance, and that plays a very important role in the development of type 2 diabetes. So, some of the consequences of high cortisol that you might notice are sugar cravings, shakiness between meals, binge eating, weight gain around the middle, just to name a few. And so, how do you know if your cortisol is high? Well, sometimes some of the symptoms I've mentioned could be high cortisol, could be low testosterone or thyroid abnormalities, which we've talked about before. But the best way to know is really by doing a saliva test where you check your cortisol level several times throughout the day. And then you can see, is it normal, is it high, or is it low? Saliva kits are available. We actually have some here at Pro Health Services that if you're interested, you can reach out to us. And again, we can have a conversation and talk about checking your cortisol levels and see where you place on the spectrum. So, how to lower cortisol? If it comes back high, what kind of things can be done? Well, thing number one is stress reduction, learning how to set limits, learning how to say no, and just taking care of yourself when you're stress load. Other things such as Tai Chi, prayer, meditation, and yoga can help with stress reduction. And then there's also adaptogenic or calming herbs available that can help try to lower your cortisol level. We have some of those available in the office as well. So, again, high cortisol can wreak havoc and it can lead to weight problems, in addition to other hormone imbalances such as the testosterone and the thyroid, as we talked about, in addition, insulin resistance, which can lead to type 2 diabetes, etc. But the good news is there is safe and effective treatment available. So, to summarize, cortisol is a hormone that actually increases with age, whereas everything else we talked about typically decreases with age. And it's released in stressful situations. Again, whether it's emotional stress, physical stress, and it's released to be helpful. And it's supposed to return to normal when the stress is gone, but because we run ourselves ragged, it doesn't always happen. And chronically high cortisol can wreak havoc, can lead to weight problems in addition to hormone imbalance and thyroid dysfunction, and again, all the symptoms associated with that. Well, again, treatment is available here at Pro Health Services, and I would love to help you get some symptom relief. So if this information was helpful, or if you learned something new, please type helpful in the comments below. And again, please be sure to share this video because there are so many people suffering with these symptoms and not knowing where to go for help. In addition, you can subscribe to our free newsletter if you go to prohealthservices.org and you can click on the button that says newsletter, and that'll give you some tips and tricks as well. So imagine for a moment if we worked together and how much better you would feel if you had an easier time losing weight because your cortisol was in the healthy range, or if your other hormones were optimized, your thyroid, your testosterone, your estrogen, or if you had more energy, if you were able to think clearer, or had improved memory or cognition, or possibly improved libido and function. I would love to help you get there. So again, please visit prohealthservices.org or click the link in the comments to take us to our website and schedule a consult or give us a call at 614-442-2600. Thank you so much for joining me. Again, this is Dr. A, and I will be back next Thursday at 12:30 p.m. Eastern Standard Time. Hope to see you then. Bye for now.